Hello, Elevation Health family. Good morning. This is Dr. Dave Yachter. Thank you for joining me today for our Condition of the Week segment. We're going to be talking about urinary tract infection. I thought this was important because it's not something that we discuss very often. You wouldn't think it's a common condition, but it's actually one of the most frequent clinical bacterial infections in women, and it accounts for nearly 25% of all the infections that are reported. Around 50 to 60% of women will develop a UTI in their lifetime. And it's an infection in any part of your urinary system, your kidneys, ureters, bladder, and urethra. And most infections involve the lower urinary tract, which is the bladder and the urethra. Women are really at the greatest risk of developing a urinary tract infection more than men, and serious consequences can occur if it spreads to the kidneys. So doctors usually will treat a UTI with antibiotics, but there are other things that can be done, as we're going to discuss now, and you can take steps to reduce your chances and prevent getting a UTI in the first place. The most common symptoms that we see when you do have a urinary tract infection is strong, persistent urge to urinate, burning sensation when urinating, urine that appears cloudy, urine that appears bright red, pink, unusually colored, a sign of blood in the urine, a strong smelling urine, and very common is pelvic pain. What causes urinary tract infection? It's usually when the bacteria enters into the urinary tract through the urethra, and then it starts to multiply in the bladder. And some of the things that provoke this or the risk factors, which are more common, obviously, in women, would be just like the female anatomy, because a woman has a shorter urethra than a man does, and that shortens the distance that the bacteria needs to travel to reach the bladder. Certain types of birth control, like diaphragms and things of that nature, are going to introduce bacteria more readily into those areas. Blockages in the urinary tract, such as kidney stones or an enlarged prostate, in men can trap urine in the bladder and increase the risk of a UTI. A suppressed immune system, for example, diabetes and other diseases that impair the immune system, can easily give bacteria a foothold in that area. And it's not just a disease, it just can be stress in general. If you're not getting enough sleep, if you're toxic, too much sugar, this can all weaken your immune system and present this as the same problem and create an opportunity for bacteria to wreak havoc in there. Catheter usage increases the risk of that. Recent urinary procedures, if there's surgery or an exam of the urinary tract, that can introduce bacteria into that area as well. So you can take steps to reduce your risk of urinary tract infections, manage your stress. Obviously, just work on making sure that you're keeping your immune system strong. Drink plenty of liquids, especially water. Drinking water helps to dilute the urine and ensures that you'll urinate more frequently, which can allow the bacteria to be flushed out of your system more readily. Cranberry juice, they say, it has benefit, although there aren't really conclusive studies. But when anybody asks me if they should drink cranberry juice, I don't have any reason to suggest otherwise. There's nothing harmful or detrimental about drinking cranberry juice. So it can't hurt, it can only help. But I would say the two most important things from a preventative standpoint, as far as if an individual does have urinary tract infections, reducing the risk of that, reducing the frequency, and really getting to the point where they're non-existent would be number one, which is stress management. Because if you're losing sleep, if you're not able to manage your stress, your body can't recover, your immune system crashes, and that's when you're at your highest risk of infection, not just from a urinary tract infection, but really any infection. And then the other factor would be getting adjusted. Chiropractic care, I have found over the years, can help people with a lot of things. But one of the most common things that we see when people are under chiropractic care for many years is they get sick less often. And this is attributed to the strengthening effect that the adjustments have on the immune system. People under long-term chiropractic care get sick less often. And this would also be part of seeing somebody who has a history of urinary tract infections to see less of that. I'll give you an example. Lisa wrote this. She said, before coming to see Dr. Yachter, I believed that chiropractic care was a wonderful tool to ease neck and back pain. I was extremely skeptical when Dr. Yachter told me that I shouldn't even wait until the weekend to start care, get started right away. I had so many issues with myself and my children before coming to Dr. Yachter, none of which I thought chiropractic care would help, but I got started anyway. I would get urinary tract infections at least 5 or 6 times a year. This required me to get prescriptions for antibiotics all the time. But since getting adjusted and being under care now, I have not had a single infection in 3 years. I choose to continue to get my regular weekly adjustments. My adjustments keep me from catching all the flu bugs that go around. In fact, I've only been sick twice in the last 3 years since I've been under chiropractic care. I tell everyone who will listen that this is the best way to manage your health. So, and another one, Narissa wrote this. She said, prior to beginning chiropractic care, I suffered from headaches, lower back and neck pain, migraines that happened like clockwork every 4 weeks or so, ear infections, eczema on my legs, and every couple of months I suffered from urinary tract infections, she said. She said, I have been to chiropractors before, but stopped going once the pain stopped, but it came back once I stopped going. Since coming here to Dr. Yachter's office, I've noticed a tremendous improvement in my overall health. I now have no more eczema, I'm losing weight and inches, and the migraines are less common, and the UTIs have yet to return. I have little or no back pain, no more neck pain, and feel better than I have in a long time. Since coming here has helped me, I'd recommend Elevation Health to anyone looking to improve their health and their life, she says. So there's just a couple of examples of what not to do and what to do instead, and obviously, most importantly, be preventative. And that's where chiropractic really shines. For those of you who are listening right now, the most important thing is not getting well, it's staying well. Regular chiropractic adjustments have a proven track record to help keep you out of doctor's offices, off medication, and out of hospitals. And that's what I wanted to share with you today. That's our message. If you know people that need to get well, tell them about us. Please share this. I love and appreciate you. Thank you so much for joining me today. God bless.